to your home. This is Black Nurse Talk. My name is Monica. I am a registered nurse. I have put together this panel of experienced, educated black women, and so I wanted to basically speak on the unspoken exclusion that all of us have talked about, have experienced, but sometimes it's not always recognized. So I would like to introduce my guest panels today. I really appreciate them for coming out, helping me out with this. So let's see who they are.
Hi, I am Tiffany. I am a registered nurse as well. I am baccalaureate prepared, also working on my master's in nurse practitioner. I have been a nurse for almost 21 years, and my experience is from home health all the way to the bedside where I currently am practicing. I have been in management several times, and I just kind of just been doing what you do as a nurse. I love it. I wouldn't choose any other profession.
Awesome. And my other guest panel.
Hello, my name is Erica. I am master's prepared. I have been a nurse for 14 years. I have a variety of background, ranging from medicine to mother-baby to GI lab, and now I am in on the insurance side of nursing. So I absolutely love nursing. It is my passion. I actually tried to leave the profession a couple times, but just was drawn right back. So it's something that I live, eat, sleep, and breathe, and I love it as well. So
All right. Thanks, guys. Like I said, thank you for being here. And I've been a nurse for 16 years now. My background is primary hospital. I have done smaller hospitals as well. I currently work what's called like floating. So I am ICU prepared. So I'm ICU nurses that staffs on the floors. So what I wanted to talk about, you guys, so us being as nurses, we, like I said, we gather together and we talk about these conversations and talk about these experiences within the black nursing community. But we don't always know that our counterparts, like the other majority Caucasians, may experience or know what we experience as being a black nurse. So I just wanted to open up a conversation, to get people talking about it, to everybody to feel included. So I wanted to just bring out some things. So ladies, so today let's talk about the nursing experience in college. So we all know we go to nursing school, you go to clinics. So Tiffany, can you speak on your nursing experience when you were in clinics or school?
So my nursing experience started out very early. I went to LPN school right out of high school. So as a baby, I became a nurse. I was an LPN at 19, and my school experience was a little rough. I did attend LPN school through the St. Louis Board of Education, which is our public school system. While there were a lot of African American instructors, they were really hard on us. And I remember one instructor in particular who really just kind of bashed the young black students that were there. She was like, oh, I've never been an LPN, and I'm an RN this, RN that. And I remember asking her, well, as an African American preceptor and teacher, then why are you teaching LPN students, and why are you making it so hard for us? And she ultimately said, I've been waiting for someone to ask that question because the world is hard on us. So if at any point and you feel like that I've done you wrong, just imagine that 10 times stronger when you get out there with people who don't know you, who don't care you, and don't care about what you look like.
Right.
And so to me, that was eye-opening because I thought she didn't like me or didn't like us or was talking down on us. But in her mind, she was trying to prepare us for what we would experience as young nurses out in the field. I also had an experience whereas I was working as a CNA through nursing school, and I was going through class, and the teacher would not let me take the test. For whatever reason, I'm not sure, but when she found out that I was in nursing school, she treated me very different. And she said to me, nursing is very hard. You may want to think about doing something else like being a teacher or maybe a phlebotomist or something like that, because nursing is stressful. And I said, no. What I'm going to do is be a nurse, finish nursing school, then I'm going to come back and be your boss. That's my plan.
Yes.
And so from then on, I just made it my life goal and my mission to do whatever it is I wanted to do and be the best at it. So
Yeah, it's just like when you, like when the instructors, when you have it, it's hard to hear that you have to have an instructor that has to be hard on you because they already know. You shouldn't even have to be hard on me for that purpose, because it should be all inclusive.
Right.
But they unfortunately know the reality of things. And for her to have to prepare you for that, along with your nursing curriculum, it speaks to what we've been talking about. You know what I'm saying? It's like it is, and a lot of people are discouraged. When I was in nursing school, my clinic, it was the most part, and we had one instructor that was quote unquote was like, they said racism, but to me, I'm like, regardless if she's racism or not, I am going to finish. And she did make it hard for us, and with grading with our clinicals, our plan of cares and stuff like that, and I had to formulate, I know you young ladies probably did too, formulate a group of like-minded people, African Americans, that knew the struggle, that knew like home stuff going on, things going on, family, and then yet going through nursing school and having this discrimination, like I can't do it, or my white counterparts are gonna like succeed and overpass me. So we formulated a group to just get through nursing school, to encourage each other to get through the programs. So I totally understand, and it's sad that it's recognized, that your teacher had to recognize that and then to prepare you guys for that. So Erica, how was yours?
Well, my experience was quite a bit different. I didn't attend nursing school here. I actually went to nursing school in Florida. Florida is the area that I was in was pretty diverse. Our school, a group of nursing students we started off pretty diverse group. By the first semester, I think we had maybe like, as far as with minorities, we had maybe like, I would say about 12, and then by the end of the program it was 5. So five students. We all still to this day formed a bond. We had similar situations. We had one nursing instructor that was very hard on us. To this day, that nursing instructor is our friend. She pushed us through nursing school. She was very tough on us. At first we thought that she did not like us. We had to overachieve, work extra hard, but I know now why she prepared us. My experience as far as with, the academic portion of nursing, it was difficult. Our group, they made us feel like we had cheated throughout our nursing school. That I remember specifically, we had to take a test over because they thought that, someone in the class had cheated. And I specifically remember in my nursing career, one of our professors had told us, if you are a student that is just an average student and you basically make, C's, that it's going to be difficult for you to pass your boards. Wow. Go figure. I was an average student, and I passed my boards on the first time. And not only that, the 5 minority students that we are friends to this day, all are passed their boards on the first time, and we are all master prepared. And even my other friend, Jaquez, he has his DNP. So it was very difficult. It was very difficult in nursing school. I would not do it again to save my life. I even called my first ulcer my nursing ulcer, in my stomach. So it was difficult. Just the nuances of just proving yourself and being there every day was just so difficult. I wouldn't do it again.
Yeah,
I wouldn't do it again.
I know. And it's a struggle for like all nursing students, but for African American nurses, Black nurses, it's just like we always have to go 10 times harder
and beyond.
Beyond, because we're trying to compete with a world that's not even, feels like we worthy even to come out there and compete with them. Yes. So you always constantly got to compete with them. Yes, I understand all those experiences. Let's talk about just working on like the interactions with the nurses on the units. So I know, Erica, you came from the GI lab. You did clinical teaching. You was an instructor there. How is it working working in just the lab itself? Your interactions with the patients, with the doctors. How would you speak on that? How would you say?
I would say my interaction in the lab, and that's a great question you asked. I was the only black nurse when I worked in the GI lab. So just imagine that in a world of where you see most, African Americans are pretty much, when they're diagnosed with colon cancer, it's advanced stages. So when I would get a lot of, African American patients that came in, they were relieved to see me because they looked around and did not see anyone else that looked like them.
Right.
We kind of already, African Americans and minorities within itself, we kind of always overall have a distrust with the medical profession. And me being passionate about being in the GI lab, it was my passion to make it to where African Americans would come and get their colonoscopy and annual exams. But it was difficult as well. I had a lot of great staff when I worked in the GI lab, and I would invite my white counterparts or people that didn't look like me to ask me questions, and most of them did, but there were some that still, again, were these microaggressions that they would do, or it's like you didn't know what you were doing as a nurse, or they felt like that, you weren't worthy to be, in that specialized area. So, it was my goal to learn everything that I needed to about GI, and I did that. It was one of my longest career, and it was difficult. It was difficult there as well. Our upper management, there were no minorities. So if I did have issues with race, or I felt like I was being discriminated against, it was nobody to really piggyback things off of. So it was like I was fighting myself. I had to just internalize everything and just continue on until, of course we had an HR, but of course, there was not a lot of representation as well in HR. But it was quite difficult, just being one, the only minority in any area. It's
because you feel
difficult.
Like you can't. There's nobody that understands your experience. You know what I'm saying? And it's like you don't want that look of the angry black woman. Right. You know what I'm saying? Yeah. That's where that microaggression comes from. Like our counterparts, our white counterparts, is like, okay, so if I come back to you, I have to be very cautious on how I say it. I have to be very cautious on how I look at you. And do I have a target
on my back?
And do I have a target if I speak up? You know what I'm saying?
That all too well from working in cardiac services.
Yes, exactly. All too well, because cardiac is supposed to be like cardiac neurosurgery, all those top high things, you know, and people
the
feel
tiaras of the hospital.
Yes. And so you like, okay, I'm not the angry black woman, but I feel like I can't express myself because from my, how I express myself may not be always how you express yourself. Or if I try to talk, I have to be very, okay, let me make sure I don't sound very angry. Let me make sure my face doesn't look angry, to get my point across. Otherwise, you get walked on, you get looked down on, and you don't show your worth. You know what I'm saying?
Yes.
What do you think? Or Tiffany, I'm just like...
I agree. My experience as a young nurse coming out, my very first job was a nursing home. And I was the charge nurse at the nursing home. And the CNAs were either older black women or older white women. And so probably the third day on the job, the CMT called in. And I was the charge nurse. The girl who precepted me did not show up. So I was it. The ladies basically did what they wanted to do. They didn't change their patients. And so I said, okay, I'm going to be responsible. So I tried to talk to them. They cursed me out. One lady was like, I'm so sick and tired of these little young black heifers coming in here trying to tell me what to do. Just went off. And at 19, I was so green. I was like, is this what it does? Wow. So I reached out to the supervisor, and she was like, well, you're in charge. Figure it out.
That's right.
And I was like, okay, so at 19, I'm like, I ain't never been in charge of nobody. My background was steak and shake. Fries and shakes. That's what I did. So I was like, okay, I went and I marked each 35 patients. I marked their diapers. And I said, well, it's time for rounds. I'll pass the meds and we can go down the hall, change the diapers. Well, they never changed the patients. I got followed to my car because I reported them. And for me, it was interesting because the older black ladies and the white ladies were like so mean. And it's like, okay, so I look like you, and I was looking for that support, that
Right.
motherly support, although I'm a new nurse, but like we the same, but I guess we're not. And these young black heifers and, just going off. And then I was like, okay, that terrified me. I was done with nursing. And then I said, okay, well, let me try the hospital. That was that was a very different experience. For whereas I was the only black nurse hired. I probably shouldn't say that. But anyway, on a neurosurgery unit, and again, very young. They put me on nights because another person wanted days. And although she came after me, they gave it to her. Of course, she didn't look like me. And it was hell. They did whatever they wanted to do with my schedule, even though I was in school at the time to become an RN. They really made it difficult. And then after becoming an RN, I worked in medicine for 10 years, where I felt a little bit more at ease because the ladies that trained me looked like me. The management did not. I'm still at the current hospital that I am when I became an RN, and there was probably for 10, 15 years of my career, I didn't see much of anybody that looked like me in management.
Same here.
So I thought that there was a glass ceiling.
Yes.
Right? And then experience that Monica and I had working on cardiothoracic surgery. I said I would never work it because the surgeons are horrible, mean. The nurses are very stern. And I recall when I interviewed, I actually was in special float pool, so I floated all around. I went there and I stayed there for probably, 2 assignments, and then they wanted to hire me on. Well, however, Monica and I met, and she was like the only black nurse on day shift, and there was one on nights who really wasn't. She looked like us, but she didn't identify with us, if that makes sense.
Yes.
So Monica and I clicked right away, and they were like, "Oh, stay away from her because she's this," and I would be like, "Really?" And I would be like, "So Monica," such she would be like, and I get it because you had to. I would watch them and they would say things about her because she was quiet and she kept to herself. And I was like that when I came. I'm a social butterfly, but I had to feel people out, and nobody identified with her. And they thought that, they're new nurses, they don't know, but didn't realize she had been a nurse 5 years before this on the medicine floor.
And they assumed
that she didn't know what she was doing. And one of the smartest nurses on the floor, but she got that attitude. I got that attitude, and the surgeons would dog us out. I had an experience with a surgeon who basically, he said, "What is your education?"
Wow.
Yes.
And I said, "Nurse." "No, what is your education?"
Wow.
"Registered nurse." "No, are you a bachelor's prepared, master's? What is your education?" I said, "Registered nurse." It doesn't matter what my degree says. Right. The patients call me nurse.
Exactly.
And so that happens often. And then moving to neurosurgery, it was the same thing. They were filling me out, and the director and I had issues. Of course, she didn't look like me, but we had issues because I didn't look the part. I didn't look
what
like
does that
what,
mean?
So
Exactly.
What does that mean?
Like
I was a heavier nurse, and I literally, I'm so I don't really pay attention to the things that go on around me. I pay attention to my patients and what my staff needs. I came on as an assistant nurse manager. Right. We had never had a conversation. She never got to know who I was, but she wasn't feeling me. She didn't like me for some reason, and I didn't know why. But there was a lot of things that came into play with race that happened on the floor. And just to bring it in, there was a huge diversity something that happened, right, a few years back. And I got chosen to be in that group of what they did. And they asked us our experience. And I told them my experience. And I said, I'm about to leave the company that I've been with almost 20 years because of this. And they were dumbfounded. The next year there were black managers everywhere. And I was like, wow. So it took a pilot of some kind for you to, or for somebody else outside the company to come in and say, hey, the management is not representative of the staff on the floor, and a lot of floors, the caregivers are not representative of the patients. The patients started saying, you know, like you said earlier, that patients, we don't, as Black African Americans, we don't trust healthcare systems.
No,
you don't.
We don't
it's
trust
not
it.
a lot of us.
And so when they see us and we have that dialogue and that conversation with them, they become more trusting. And so when they don't see us at the bedside, they are labeled non-compliant or whatever because they don't trust who the people are because they don't understand. And they give us stuff anyway. Well, you're high blood pressure, diabetes because of this, your lifestyle, because of what you eat. But statistically, we're not the ones with the highest incidence of the problems, you know, but nobody knows that. They just go off of what they see and what they know. And as case manager, it was a lot of the same. A lot of patients did not even know that there were Black case managers in the facility because they would come and go, or they wouldn't come and actually see the patients. A lot of people do phone calls to the room and to do their assessment, but I actually go in and I engage them and their families, and they're like, wow.
That's important.
I give them resources, you know, because I understand once you leave this hospital, the resources are slim to none, or they don't know who to talk to. So that's kind of been my experience, as well as in the nurse homes being called a niglet by a patient.
I've been called a
spit
colored
on,
girl,
or coming in that we have tags that say RN and be like, can you change my sheets? Are you housekeeping? Can you? And it says registered nurse. Or can you tell my nurse to? And I come back with the medicine. They're like, oh.
Yes.
And it's like,
This is true.
And that's to speak on experience like recently I had. You know, I was working in the ICU, neuro ICU, and I'm sitting, there's a small ICU. So it's 3 nurses. Well, it's 2 nurses that was working on that floor. And there was 1 nurse that came overcharged from the other side. Okay? My patient, small unit. We all sitting there, 3 nurses sitting there, or 2 nurses sitting there, 1 nurse standing. Doctor comes over. New patient comes in. I'm very close as we are sitting together. He asks my white counterpart, the other white counterpart. He's asking them questions about the patient. So how was the patient who came in? How was this and this? And I'm like, they like,
not a patient.
We're not the nurse.
Right.
He'd be like, oh, well, what was their vital sign? And I'm said, sir, it's my patient. I recently, just a couple of minutes ago, when the patient first hit the floor, doctor comes up and I say, hey, new patient's here. This is what the patient's here for. So you know I had some primary affiliation with that patient. But yet you talk everybody else around me except me as assuming that I'm not the registered nurse. I'm the tech. I had the same colors on as the other ladies. And yet you talked all the way around me. And I was like, well, sir, I'm the primary nurse, so I can give you all the information that they cannot. They are here to help me. I'm the primary nurse. I've taken over this patient. Oh, as if I didn't qualify to be a nurse? I got the same thing. But yet, you will always seem like they always look over you. They look over you. You become invisible. Right, you literally do.
It's the truth, yeah.
And so, that experience is like, okay, we're still doing this. We're still doing this.
2020.
We're still doing this.
We still have not overcome.
Yeah, I would walk, just like when you walk into a patient room. I got the badge on. My badge is flipped so you can make sure you can see who I am. And you're like, oh, where? Have you seen my nurse?
Hello.
Yeah, that's me. That's me.
Or, I haven't seen my nurse all day.
Yes.
I haven't seen my nurse all day. Well, who do you think I was in here listening to your lungs?
Yes.
Gave you
Giving you your medicine.
Yes.
I love that when the charge nurses come around to round. I haven't seen my nurse all day. She hasn't rounded. Nobody's rounding on me. And I'm like, excuse me. Yes, I'm that one that woke you up this morning and say, hey,
Here I am.
we're going to talk about you at the bedside and open the computer. That was me.
Yeah, that's what we was doing, that exchange.
Yeah.
Yes. So, for it to be the way it is in 2020. Now, we talked